Hello, it's Dr. Rhonda Johnson, and today is Wednesday, August 26, 2020. And today I'm going to be talking about controversy from the CDC around COVID-19 testing. I'm going to be also talking about COVID-19 fatigue. Now, again, I want to just reset. My only purpose of doing these tapings is to just help explain things in lay terms that I think is important for the general public. My only goal is to help save lives, period. So I'm talking today about the controversy between the medical and public health community around the new CDC recommendations for COVID-19 testing. Well, a couple of days ago, the CDC changed its COVID-19 testing guidelines and now says people without symptoms do not necessarily need a test, even if they have been exposed to COVID-19. So let's kind of translate that into real life scenarios. So let's say your coworker finds out that his wife now has COVID-19. This is somebody that you work with every day in, reasonable close proximity. This would mean that your coworker, whose wife has tested positive for COVID-19, would not need to be tested, can keep going to work as long as he's asymptomatic, quote, and will not need to be quarantined or stay at home, unless his job, of course, makes him. But again, it just depends on if he's an essential worker or what. It could be that he doesn't want to reveal his exposure to COVID-19 because he needs his paycheck. So the bottom line is this could result in lots of his coworkers being exposed to the virus, because remember, people are most infectious before they start showing symptoms. Another possible scenario has to do with our schools. So let's say school has reopened and a student or a couple students test positive for COVID-19 in a given teacher's classroom. Well, that means that none of her children in her class would need to be tested because, again, children often show very mild symptoms. And again, the teacher may not need to be tested, so she could pass this asymptomatic, let's say she gets asymptomatic disease, or she could pass that infection to a number of her fellow co-teachers before she developed symptoms. And again, this just flies in face of every known principle of public health to control a pandemic. You have to know where it is. I mean, that's just basic simplicity. And you contain it through diagnosing and contact tracing in a pandemic and quarantine. That's how you contain a disease. So this is creating quite a controversy. We also know that roughly 40% of COVID infections are being transmitted by people who are asymptomatic. They have the disease, they don't know that they have it, and now the CDC is saying they don't need to be tested. So again, if that goes into place, then we're never going to get this pandemic under control. Now, why, you may ask, has this happened? I'm sure you've got your own ideas. But again, we've been hearing the president say that there's too much testing going on. And also we have an important election coming up. And as the death toll mounts and the cases keep climbing, this is the greatest public health failure. And you compare our country's response to other countries who've been able to contain this pandemic, countries that, quote, aren't as sophisticated or technologically advanced or do not have the sophisticated medical care system that we have. And it kind of makes us look bad in the eyes of the world, right? So if you don't test, then your numbers don't keep climbing. And even in the state of Florida, a state where the disease right now is out of control, the medical examiners, those are the people that, certify the dead, they are no longer being required to certify COVID-19 deaths. So here you have a situation in the state with the biggest outbreak and people are dying. hospitals are full, and the medical examiners don't even have to certify someone is dying of COVID-19. This is just unprecedented. I don't know what else to say, but I just want to let you know that most doctors will tell you that if you're exposed to somebody with COVID-19, do get tested. I want to encourage people to get testing. We need more testing, not less testing. Okay, enough of that. Another controversy this past week has been around the FDA, the Food and Drug Administration's emergency use approval of blood plasma as a COVID-19 treatment for hospitalized coronavirus patients. Many doctors just don't feel that the studies are strong enough to warrant this as treatment. And they're saying that the evidence from clinical trials just isn't there. Now, this blood plasma has already been used for more than 70,000 hospitalized patients. But here's the catch. It can't be manufactured in millions of doses. You only get blood plasma from blood donors. So it's going to be kind of limited. And again, the doctors are just concerned that there's not enough evidence to warrant this use outside of a clinical trial. So again, we have a case of, seems like politics interfering in the science, in the management of this pandemic. And unfortunately, all it does is undermine the public's confidence in both the integrity of the science and the political management. So this leads me to a discussion on COVID-19 fatigue. No, I'm not talking about physical fatigue. I'm talking about mental fatigue. And that could lead to dangerous complications. Well, because, this pandemic, we're tired of it. People are tired of being cooped up. They're tired of being careful. They're tired of it being on the news. They're tired of being scared. Collectively, we're just tired of this. And that's part of the reason why some people are taking risks and being careless and not wearing a mask and going to these parties. So managing this COVID fatigue is important, not only to one's personal health, but for beating this pandemic. We're starting to hear the saying, abnormal is the new normal. And most of us don't like being in the abnormal. And knowing why we feel that everything is abnormal can help us to get to the new normal. So for some people, what's so abnormal about this is they can't see an end in sight. Others, it's a combination of these, the pandemic plus the racial killings and protests. Some, it's the uncertainty about almost everything in their lives. Some, it's a lack of people pulling together and all the division. For some, it's a lack of coordinated response to the government. What is your reason for COVID fatigue? That's important that you know it so you can begin to manage it. So how do you cope? Again, I've been talking a lot about coping, and it is repetitious, but it is worth it. So some coping tips include exercise. The number one best thing we can do for coping, even if it's a simple walk or dancing, whatever that is for you. Exercise releases endorphins, which helps get your mood into a better place. Get outside, talk to people, think positively, and let it go. You can't control everything, but you can control some things. And what you can control is how you respond to this pandemic by use of the 3 W's. Another way is to limit things that trigger angry responses. I know I turn off the news on the weekend. I have a couple days where I'm just not on the news, and I just stay away from it. People who upset you on social media, again, I've been blocking people because I just don't want to hear some of their comments. So again, remember that you do have some control. You have control over your mindfulness. You have control over the acts of kindness that you can contribute in this pandemic. So sometimes you have to just get out there. You know, if you want to get out there and visit your family, do so in small numbers. Wear your mask, take your hand sanitizer, and limit the amount of time that you spend indoors or go outside to have a better risk environment. So again, follow the health guidelines, do what you can do, keep a positive mindset whenever you can, and role model kindness. This is Dr. Rhonda Johnson. My views are my own. Have a blessed day and be safe.